Welcome back, future orthodontists. Today we focus on Buccally Displaced Maxillary Canines, a common orthodontic challenge. A buccally displaced maxillary canine erupts labially or buccally to its normal position in the dental arch. It may appear rotated or crowded. Remember the mnemonic BLC: buccal, labial, crowding. Causes of buccal displacement include lack of space in the arch, early loss of deciduous teeth, genetics or abnormal tooth size, abnormal eruption path, and supernumerary teeth or cysts. Use the mnemonic SLGAS: space, loss, genetics, abnormal path, supernumerary. Understanding etiology helps plan interception or corrective treatment. Diagnosis involves clinical examination by palpating the canine bulge and checking crowding, radiographs like panoramic or CBCT if impacted, and evaluating occlusion and symmetry. Mnemonic: CRO. Clinical, radiograph, occlusion. Early detection is key to avoid complex treatment later. Management depends on patient age and severity. Observation is possible if there is minimal displacement and enough space. Interceptive treatment may involve extraction of deciduous canines to guide eruption. Orthodontic traction uses braces and auxiliary appliances to align the canine. Surgical exposure is required for severely displaced or impacted canines. Mnemonic: OITS. Observe, intercept, traction, surgery. Always tailor the strategy to the individual patient. To summarize, Buccally Displaced Maxillary Canine's essentials are definition, BLC, buccal, labial, crowding; etiology, SLGAS, space, loss, genetics, abnormal path, supernumerary; diagnosis, CRO, clinical, radiograph, occlusion; management, OITS, observe, intercept, traction, surgery. Quiz time. Question 1. What does BLC stand for? Question 2. Which is a common cause of buccal canine displacement? Question 3. Which diagnostic tools are used? Question 4. Management options include what? Excellent! You now understand buccally displaced maxillary canines, their causes, diagnosis, and management strategies. Next video, palatally displaced canines.